we have House File 1346. So I will move House File 1346 before the committee to be re-referred to the Human Services Committee. Representative Nash, feel free to introduce your wonderful bill.
Good afternoon, Mr. Chair and members of the committee. Jim Nash. For those of you that have been on the committee or have been incumbents, and I don't see any new members, you know that I've been working on this issue for a number of years, and some of you know my history, but I'll state it again for posterity and for those watching online. I grew up as an abused kid, and for 17 years of my life, my dad beat the crap out of me, and I suffered through a lot of things. As a corollary to that, my abuser passed away last Thursday, so there's now a little bit of closure where there wasn't previously. So that's both messy and good at the same time, but it makes it easier to publish the book that I'm working on. So, but 1346 is a bill that has been underway for a little while in working with some of the advocates that are in and around this issue. And it's really to elevate and try to standardize some of the training that goes on for mandatory reporters. It is something that everybody knows that mandatory reporters play a critical role. And you may remember that the most important person in my life who was a mandatory reporter, my mom, failed and didn't turn my abuser in. But this bill seeks to bring a higher level of detail to the training, provide a greater level of standardization. There will be other bills that I work on after the fact as well to really kind of remove a patchwork of training as it relates to mandatory reporters across the state of Minnesota. But you know, this is a personal issue for me, but I also know that there's a great many kids in the state of Minnesota that are watching the legislature and are saying, I really need some champions. So I hope that you all will join me in being a champion for the kids around our state that need somebody to stand up for them. And I will thank the department, because this language was really sort of, we met in a couple of times and we had conversations and we were very frank about some of the needs that are present. So this is really an output of that work. And Mr. Chair, there are some testifiers, so if we can just move right along to them. I don't want to belabor your committee, but we do have some testifiers, so we can bring them forward at the time.
Thank you, Representative Nash.
Apparently, we're having technology issues.
Oh.
So sorry.
We are having,
They both are on. Laptop.
I can sing show tunes if necessary to fill the time.
well, okay.
That hasn't happened yet. If you don't want to just like step off to the side so we can do the meeting and then we can just, sorry about that.
We are going to soldier right along. If I would ask Chair Katiz-Batoon, Vice Chair Hansen, are we okay to soldier along, or would you like us to wait? Okay. And this is why I hate Zoom. All right. We will pass the high chews around. Anybody prefer Hershey Kisses? Okay. Hey, we had training on that, Representative McDonald. Well, I'll recess the committee. Call this meeting back to order. Representative Nash, I apologize for that delay. Please, well, now we're on public testimony, that's where we're
And
left.
Mr. Chair, would you let me go back and do the introduction of the bill so that all people watching on Zoom can benefit from the dulcet tones of Jim Nash, or should we just move along? All right, well, so members, Jim Nash, District 48A, House File 1346 is, as I had said previously for those in the room, that it's really an effort that I have been undertaking since last year, where I shared with a lot of you that were here in the committee or on the floor that as a kid who grew up as an abused child, this has become very, very important for me. I had shared to those in the committee that my abuser died last Thursday, and while people struggle to rush to apologize, saying sorry, I don't know that that's something that I need right now. But the reality is, we have a lot of kids in the state of Minnesota who need a well-trained mandatory reporter. And 1346 seeks to do just that. It's to create a standardized and greater detailed training that will help people become a better mandatory reporter. The gist of the bill is really in subdivision 2 and forward. It is not an onerous amount of new information, but I think what will happen is it's going to get mandatory reporters better trained to identify what does abuse look like and how do we stop it. For those of us that have grown up as abused, we know what it looks like. And as I had said earlier, I would ask that you join me in being a champion for the kids that need somebody who will stand up for them. Because as simple as it sounds, it's apparently not that simple. Because as I had shared before we recessed and came back, and this is for the benefit of the people online, the person that I relied on to be my mandatory reporter, which was my mom, who was the director of nursing, failed miserably and did not report my father's abuse. We can fix that. We should all join together, whether we're Republican or Democrat. The kids in our district need a champion. So I would ask that you join me in doing that. And Mr. Chair, as I'd said, I have a testifier, Melissa DeBilzen. If she would come up to the testifier's table, she's going to provide some brief oversight. Mr. Chair, is there somebody online to testify as well, or is it?
Is there somebody online?
No. Just send somewhere.
Not that we are aware of.
Okay, thank you, Mr. Chair.
Representative Nash. Ms. DeBills.
Thank you, Mr. Chair and members of the committee. My name is Melissa DeBilzen, and I'm the Executive Director of Safe Passage for Children of Minnesota, a nonprofit advocating for the safety and well-being of children at risk of maltreatment. We work closely with a number of frontline professionals in the child welfare system. Child abuse is a significant but often overlooked issue in Minnesota. We see this in state data, but it is rarely discussed publicly. In 2022, around 5,000 children were confirmed victims of abuse, and tragically, 21 children lost their lives. If this were a childhood disease, we would be pouring money into treatments and cures. Like a disease, we know that prevention is key, and there are better outcomes for kids when abuse and neglect are detected and mitigated early on. This is where mandated reporters come in. Mandated reporters play a critical role. These teachers, childcare providers, healthcare workers, law enforcement, and social services professionals are often a child's first line of defense. Nearly 80,000 reports of potential maltreatment were made across Minnesota counties in 2022, and 80% of them originated from mandated reporters. Robust training for mandated reporters is essential. However, after reviewing the state's mandated reporter training, we were shocked by what was and wasn't being taught. Of the 45-minute training, only 2 to 3 minutes were dedicated to recognizing signs of maltreatment. Additionally, the training misrepresented child protection as potentially harmful to families and included guidance that contradicted state law, such as requiring reporters to be certain of maltreatment rather than having reason to believe. Fortunately, the Child Welfare Training Academy has been open to feedback. To build on their openness to continuous improvement, we strongly support Representative Nash's bill, which ensures training meets two basic requirements. First, at least half the training must focus on recognizing signs of maltreatment. This is important because daycare workers may not realize that any bruises on infants under 4 months old are suspicious. A preschool teacher might not know that bruises on the neck are rare and concerning. A school secretary seeing a child regularly arrive hungry may not know if it's poverty or statutory neglect. A few minutes of training simply is not enough. Signs of maltreatment must be incorporated into mandated reporter training, not treated as an afterthought. Second, training must be informed by professionals with expertise in child maltreatment. A child abuse pediatrician, for example, is best suited to educate on physical signs of abuse. An attorney ensures legal accuracy. A mental health professional can advise on sensitive questioning, and a social worker can provide insight on available resources. This is a simple, common sense bill that can have a profound impact on protecting Minnesota's children. I urge your support to ensure mandated reporters receive comprehensive, expert-informed training to help keep children safe. Thank you for your time and consideration, and I am open to any questions you may have.
Thank you, Ms. DeBilson. Representative Nash.
Yeah, Mr. Chair, thank you, and I would be remiss if I didn't say a thank you to my friend Representative Moeller, who is my number 2 and helped me get the stuff done last year as well. And she has been a great champion of this. I thought I was past this part, but apparently I wasn't. You know, this is really a bipartisan effort. So stakes are too high to not get this right. So again, I appreciate your assistance in this. Stand for questions.
Thank you, Representative Nash. Are there any other members of the public who would like to testify on behalf of the bill? Seeing none, I'll close public testimony and move on to member questions. Member questions. Representative Hicks.
Thank you so much, Representative Nash, for bringing this bill and for always just being such a champion. I really appreciate it. And I do just have a question, because I don't understand why it was done this way. Not a problem, just a question. Where it says suspected maltreatment, and then it crossed off suspected abuse as defined as the statute. I guess I thought we would still be doing training on suspected abuse. It wouldn't just be maltreatment, or did I misunderstand? I'm confused.
It would be.
Ms. DeBilson.
I'm sorry. Mr. Chair, it would be suspected maltreatment, so it would be suspected abuse and neglect would be the training that would be covered.
Okay.
Does that answer your question?
Representative Hicks.
Yes, thank you. I just wanted to make sure we weren't just going to focus on maltreatment, and we would still talk about the bruises on the neck and the
Yes.
abuse piece. Okay, that wasn't clear to me, and I appreciate the clarification. Thank you.
And Mr. Chair.
Representative.
And Representative, you know that I'm never going to delete things that we need to be looking for. So in consultation with nonpartisan staff who helped us draft this, that was one of the strikeouts to expand and make sure that we're getting everything that we need to get. So thank you.
Thank you. Chair Katiza Batun.
Thank you, Chair West, and thank you, Chair Nash, for being here and for sharing your story. And I know it takes a lot of courage to publicly go through the things that you've experienced. And there are so many of us at the table who have been on the other end, right, supporting kids who have already been through it. And I think it really makes a big difference when we have voices like yours at the table, when we have voices like Representative Hansen, who has shared some of her story at the table, and we all get to make better policy because of your experience. And I'm grateful for that and for you bringing this forward.
Thank you, Chair Katiza Batun. One last thing I want to say about this bill, as I'm a co-author on it, when I met with Safe Passage and they explained the bill, it was just like, oh man, this needs to happen. And in many cases, in the Small World Learning Center in Blaine, you have many suspect cases of difficulties with mandated reporter, people not even knowing, mandated reporters with their own children not even knowing they should report to the proper authorities and not just to their superior. There's a lot of confusion there, so improving this training is incredibly important. All right, and before we close it, before your closing comments, Chair Katiza Batum.
Sorry for that. I'm hoping perhaps your testifier could give us a little bit of clarity on currently who is required to go through the mandatory reporter training, and does that change? Does it get expanded at all if this moves forward, or is just the content of the training for those people who are already required? Sorry for the delay on that.
Ms. DeBilson.
Mr. Chair, it is open and available to all mandated reporters in Minnesota. I don't know the answer if they are required at this point. Someone from DCYF may know that answer. I don't know if they're required to take the training or not. I think some programs and in some, it depends on the organization, but.
This is why we have geniuses to my right. Ms. Sunderman, can you enlighten us?
Yes, Mr. Chair and members, this section does not require mandated reporters to complete or undergo training. It requires training to be offered to mandated reporters. And like the testifier said, it is typically left up to the individual organization whether or not to require their employees who are mandated reporters to do a training.
Chair Katiza Batum.
Thank you, Chair West, and I appreciate just that little bit of extra clarity. Obviously, step number one is making sure that the training covers what we needed to train or to cover, and then perhaps we talk down the line about making sure that folks are required to actually access that information. Thank you.
Representative Nash, to close us out.
Thank you, Mr. Chair, and Representative Katiza Batum, I think we just found our next bill. I'm watching the eyes as we're panning through. It's like, oh, wait, everybody should be required to take this training. So maybe we can get that jacketed up right away and get that moving, because, again, I'm grateful for the time. I'm grateful for, I know that you're with me on this. So I look forward. I'm sure some of you all will be at the next committee stop, but this is a big deal. And we have the ability as lawmakers to put a lot of the partisan differences that we may have aside to coalesce around the right issue. And this is one of those right issues. So I appreciate your support, Mr. Chair, and look forward to working with everybody along the way to get this passed.
And this is indeed the committee for that. So I will renew my motion to re-refer House File 1346 to the Committee on Human Services, Finance and Policy. All those in favor say aye. Aye. Opposed? The motion prevails, and you're on your way.
Thank you, Mr. Chair and committee.